of the RT-PCR.
Through the show of unity and selflessness, which we refer to as the Bayanihan spirit, we are demonstrating to the world that although the pandemic knocked us down, we will rise up and come together as one. Through the show of unity and selflessness,
are really the way forward in helping our Filipino people save lives and livelihoods.
Let's go bakuna. Bakit bakuna importante sa tao? Upang maging ligtas lahat protektado. Bawat matanda dapat tayo'y kalmado. Huwag tayong matakot pa, bakuna lang tayo.
Let's go, bakuna.
Angat lahat.
Let's go, bakuna.
Angat lahat.
Let's go, bakuna.
Bakuna bubble ang isinusulong ng mga negosyante para isalba sa pagkamatay ang napakaraming industriya.
Let's understand that we are not here to ground the unvaccinated. We are protecting you. We're protecting your life and allowing the vaccinated to go out, spread money so that makakatulong yung ibang negosyante.
We also launched a campaign, basically Vax to the Max, to trying to show the vaccine levels, the percentage of fully vaxxed in each area, so that other areas will also get inspired to really ramp up vaccination.
Ito po ay gagamitin namin sa aming negosyo na tapsilugan. Salamat po ulit!
The Philippines definitely will not be left behind in this fight.
This is Bayanihan. And let us win this war and save lives and livelihood.
Good morning, everybody. Magandang umaga po sa inyong lahat, sa lahat ng mga nanonood sa buong Pilipinas and beyond the Philippines. My name is Jopin Romero and I'm from Gonegosyo and ASEAN BAC. We welcome you to this town hall focused mainly on treatment of COVID. It has been 2 weeks since we last got together on January 5th. At that time, our concern was, is the surge happening? Is Omicron here in the Philippines? Is it in NCR? And hopefully you were enlightened during that discussion. Now, within the same month, January, we're having this follow-up discussion. And our experts will be giving you some updates. Kayo din po, naramdaman ninyo kung anong pagbabago nangyari in the last 2 weeks. And please prepare your questions, put them in the chat box, and then we will pick them up. We have some media friends with us today, as always, and they always ask the right questions, which we also bring up to our speakers as as their time comes. All right, so we will get on with it. We have more than 300 watchers, both in Zoom and in our other channels. And we expect this to be more because we do have a very interesting and very practical topic this morning. To kick off our program, we have 2 welcome messages. Of course, our founder of Gonegosyo and Presidential Advisor for Entrepreneurship, and also the hardworking IATF official who will be speaking after Joey, Secretary Vince Dizon. Now, Joey, may we ask you to please open the meeting formally?
Jopin, my sound check, is it okay?
Yeah, very good, thank you.
Yep, okay. Good morning to everyone. First of all, it's been 2 weeks since we had the last town hall. That was about January 5. And I felt that especially in this time, it's very important that we try to keep in touch and keep everybody informed as to how we see developments moving, as it is really evolving quite fast. I'm actually in the States right now in San Francisco. I decided to take a flight here I haven't been out of the Philippines in the last 2 years. So it was a good experience in the sense that opened my mind on, that I think we start, and I wrote that column actually on flight and when I arrived here in San Francisco to really see, I think it's about time to really move on. I think we will definitely be left behind if we remain stagnant, in what we're doing. Remember on January 5, when I asked Secretary Duque if Omicron was in the country, and he mentioned yes, but it was not a very definite yes. No, I think everybody at that time was still trying to hope that it was not going to hit the country. And in a matter of 2 weeks, we have seen the cases rise to record levels. No, I mean, very clearly, no matter what kind of quarantine we imposed, what kind of measures that we did, you really can't stop this COVID from really penetrating countries. No, like we saw with Delta, it happened with Omicron. Cases have gone up to as close as 40,000 a day, and hopefully Octa will report something good to hear. No, we basically, as I mentioned in the last town hall, we were able to save the fourth quarter, and we can see a lot of businesses still being able to operate, no, because they were able to do excellent. They were able to have good sales in the last quarter, which actually is keeping them afloat in the first quarter. We were able to convince the Metro Manila mayors and IATF that there was no need to move from alert level 3 to alert level 4, because we can see that Filipinos, as they see infection move up, of course, the fear is there, and they themselves will control their mobility. And we saw that. No? Mobility has drastically dropped in the first quarter. And I'm sure many of our restaurant owners, spa, and all of those different businesses out there can share their experiences. Yes, first quarter, aside from being a slow quarter, the fear factor of being infected with, seeing this infection on Omicron really spreading very fast, put people at home. No? And we also saw that the government accelerated its program really in trying to restrict the movement of the unvaccinated. Secretary Tugade, basically no vax, no ride program, which has exemptions to those who are going out for essentials. Of course, Secretary Bello's own initiative as well, no, on requiring all on-site workers who are unvaccinated to be subjected to an RT-PCR antigen test every 2 weeks. All of these initiatives are really for the unvaccinated to prevent them from getting severe illness and eventually them being confined in hospitals. And if the hospitals do get full, then we are faced with more serious problems for the country, and eventually these lockdowns will get moved up, to different levels, and that's what we don't want to happen. We also were able to share with you information on Molnupiravir. We have sent out 3 suppliers at much lower prices than what you can see out there, selling between 12 to 14,000 pesos. We were able to get supply out at 1,901. No? One of the suppliers are able to supply it at that low price. But of course, all of these are required with prescriptions, doctors' advice as well. So we briefed all the private sector companies who are interested. They have to follow the EUA rules, and that's very clear. The third, looking at things here where I am now and seeing how people are coping with COVID-19 in America and specifically in the Bay Area, I've noticed that but basically everybody is wearing masks. They are definitely conscious about the need to prevent themselves from getting sick, but they live a normal life. No, there's a lot of movement, and people have accepted that. No, and I think I've been sharing this with a couple of medical advisors of the government and texting them back and forth and on the approach. No, and coming to America, you basically just need an antigen test. No, within 24 hours prior to your departure out of Manila. So that's not very hard to do, no? And that's accepted. And I thought that is a good way because in our case, when we leave America, we're required to take an RT-PCR test 48 hours prior to departure. No, so and that is a bit of concern because the RT-PCR testing capacity here is at the max. So some Filipinos going home may have a problem in trying to get an appointment, no, for this RT-PCR test. I thought the idea of an antigen test prior to departure within 24 hours is good enough, no, to be able to provide enough comfort. No, it may not be as perfect as an RT-PCR, but on the RT-PCR taken either too early or may also not be effective. No? So or too late. So this is some ideas that I've mentioned to our advisors that we should think about it. I believe that eventually, yes, you have seen in the news, Thailand, Switzerland has started to open up, no, and their quarantine. Some of them are removing their quarantine, like Thailand. UK has gone the extreme by removing face masks, vaccine passports, and all of that. They just will not do anything and allow, a super normal life. We are not suggesting any such a move as that. We're not also suggesting that we implement the no quarantine immediately. What I'm proposing to our IATF members is that a gradual move towards, to me, the removal of quarantine in the Philippines and moving towards home quarantine rather than facility-based quarantine. Because my own view is that it has not actually helped us from preventing Delta or Omicron from entering the country. I mean, you can see in 2 weeks' time, Omicron has swamped, NCR, and basically, if you look at the positivity rate in the Philippines and America, it's about the same. No? We're at about 30-40%. Here, it's the same thing, 30-40%. Although some medical advisors prefer to use ADAR, and I think, to my mind, positivity is acceptable. So that is something that we are looking to discuss more with the key people in ITF, that let's plan so that as we planned last year to save the fourth quarter, as we see Omicron start to subside, then maybe we can move towards a gradual phase out of our quarantine in the country. I believe that the airlines are struggling with 3,000 passengers daily to be accepted. That's not going to make these airlines, stay viable. Number two, even our tourism sector has been, at the brink of a great struggle, and especially many of these people who invested in setting up hotels are definitely in debt. No, so we can't keep this whole sector closed, and we are actually competing against other nations like Thailand and other countries for tourists. No? And if Thailand is starting to open, I think the Philippines should start to look at opening up. No, and I think one common agreement that we have is that we should allow tourists who are only fully vaccinated, no? In the same manner that America only allows people to enter who are fully vaccinated, the same thing we should do. So these are things that I think moving forward, we will really try to engage with IDF on starting to study this whole gradual move towards the removal of quarantine. No? And I think it will benefit not only our OFWs who come home for a brief vacation, but many of those people who don't have enough funds to pay for these hotels. No? So that's another thing that we're looking at, and hopefully we succeed. No? And I think the private sector, we should really move immediately to start our boosters. I'm told that not many have started yet. The government has agreed, Secretary Galvez has agreed to return the donations back to us. So if there are any clarification that you need, you can call the Dose of Hope, one of them, Eva, or the team of Sam there that can advise you on how to get back your donations. And I think that's not going to be a problem. So I think I'm confident that we are on the way to seeing a brighter 2022 year. I'm very confident on that. I believe that our partners, OCTA, will be able to share with you information that will help us plan much better. But I think we should continue to remain optimistic. I think we have 100+ million doses of vaccines now in the Philippines. No? And we have to ensure that the demand will increase, no? Because we have the necessary supply for all of those who have not received the first and second dose and even the booster shots. No? And we've seen also the latest report on AstraZeneca as a very effective vaccine, especially if it's blended, no, with certain brands. No? So the country definitely has an adequate supply of AstraZeneca vaccines today. And we hope that the Dose of Hope, the close to 400 companies that have purchased AstraZeneca, starts to inoculate its employees with the booster shots immediately. No? So there is nothing different on what we should do. We should continue to boost our employees with these vaccines. I think it's important. And hopefully we should accomplish this within the next couple of months now, because these vaccines have an expiry date. No? Some of them will expire in April and May. Of course, the pharmaceutical companies have leeway to extend these vaccines, but up to a certain period only. No? So we are in constant communication with AstraZeneca. So the vaccines are still fine, but we should start to inoculate our employees as soon as possible. And hopefully we would achieve a fully vaxxed or close to fully vaxxed Philippines by at least April this year. No? We're already towards February, so we have a couple of more months. And I think that is what the initiative of Secretary Galvez Vince Dizon is, and trying to make vaccine accessible to all areas. And that's why they're even inoculating in the different drugstores right now. So that's a good initiative. It's being done in America, and I'm glad it's going to be done in our own country. So again, I'd like to assure all of you that we're doing our very best to really try to really bring back this normalcy. No? I think we have to have this mindset change. We can't continue to lock ourselves out. We can't continue to restrict movement. We definitely have to open up the economy. We are really buying and spending a lot of money on all of these vaccines and medical equipment and test kits and all of that. They are running into the trillions. These are not revenue generating spending. No, I mean, we will be paying. We are borrowing money for this, no? So we will be paying interest to the banks. Unlike if this money were invested in roads, bridges, and all of that, you will see a return. Here, you're seeing the return in terms of maintaining our health situation as we speak, no? But if the rest of the Filipino citizens who still insist to remain unvaccinated, then that's where the problem is, and there is where we have to put the pressure. So the economy really relies on maintaining this health situation in the country, no? And it's hard to say that, okay, those unvaxxed, bahala na kayo. If you get sick, if you die, it's your own problem. It's hard to do that, no? And that's why we have to put a lot more effort in trying to push hard that these people really take the vaccine. And we have mounted, the private sector, Go Negosyo, and others have mounted a massive campaign on really pushing and convincing the unvaccinated to get vaccinated. Thank you.
All right. Thank you very much for that, Joey, and thank you for summarizing some of the initiatives that are ongoing.
Wait, Jopin, I
yes.
forgot. No,
Yeah.
Maybe you want to also mention the initiative that we're helping with BOQ. You want to add that?
Okay. Yeah, thanks. Well, it's something that we're starting to do. We have private sector partners who are now hard at work discussing with BOQ how to address their customer service concerns. The problem was brought to us as on Sunday, and as of last night, I think we have a workable platform that can address the thousands of customer service concerns on a daily basis of BOQ, so that we can help them quickly respond to our kababayans who need the answers, and also to stop the workload from piling for BOQ. So in the same bayanihan spirit, the private sector and the government are now again working together to solve this concern. We will keep everybody updated on that as we need more help. And for you, the travelers, and for us who are needing these yellow cards, you will see the difference pretty soon as we try and solve this concern. All right, thanks for reminding, Joey. So now we've missed this executive of government in our town hall, but that's only because he's been busy really being on the ground on a daily basis, working and cheering our health officers and our frontliners to ensure that vaccine rollout will be efficient and fast in the country. So now we welcome Secretary Vince Dizon, who will also be giving us a message and some announcements. Good morning po, Secretary Vince.
Good morning, Jopin. Sir Joey, good morning po. Good afternoon, I think, or good evening, where you are.
Evening.
Good morning po sa lahat ng mga kasamahan natin. Unang-una po, I just wanted to, first of all, really thank PA Joey, Jopin, and the entire team in Go Negosyo, who's really been with us from day one. It's can't believe it's already been almost 2 years, that we've been working together. But really, we could not have done this. The national government, the government could not have done this without the support of the likes of PA Joey and our other private sector partners. And again, we cannot thank you enough for everything that you've done. We started off with trying to ramp up our testing capacity with the likes of Go Negosyo. The Philippine Red Cross helped us so much there. Then we started with, we followed that with ramping up our isolation facilities, and then obviously our vaccination rollout. And Go Negosyo and PA Joey has played such a tremendous role in ramping up our vaccinations with the agreements with AstraZeneca, with the LGUs and the other private sector companies, and also other things, other innumerable things that the private sector under the leadership of PA Joey has done throughout this last almost 2 years. But I completely agree with everything that Sir Joey said earlier, that we really need to start shifting our paradigm with the way we deal with COVID. We cannot live in fear anymore. We really have to find a way to live with this and try to achieve what we've been trying to call the new normal for so long. And I think we are finally here. And I'm very happy that our good friend, Father Nick Austriaco, is here. And I'm sure he will provide many, many insights on what he thinks is a way forward to live with the virus and try to live some semblance of normalcy while we still have to deal with COVID-19 in the foreseeable future. Right now, I am actually in the generics pharmacy headquarters in Parañaque. We're about at around 10 a.m. We're going to launch another pharmacy here in Parañaque. It's one of the 7 pilot pharmacies that we will be launching from yesterday and today. And in the next couple of days and weeks, we will be expanding this very quickly, not only in Metro Manila, but to major cities all over the country, Luzon, Visayas, and Mindanao. And we want to again thank all the pharmacies, beginning with the generics pharmacy, the Gokongwei Group, South Star Drug, Rose Pharmacy, Mercury Drug, Watson's, the SM Group, Generica Drugstore, the Ayala Group, and all the other pharmacies that have really volunteered. No, we just spoke to them over the holidays, and just in a matter of 2 weeks, we are now rolling this out very quickly. And I think, as Sir Joey said, in the US, this is what they're doing. And they've been doing this for quite some time, and it's proven to be effective. And I think that's one of the things that I wanted to talk about in this short keynote, is that one way of living with the virus and moving into the new normal is really sharing the responsibility. And because the government cannot do this forever. There are limited resources, both financial resources, human resources, especially human resources, as we have seen when government workers, government doctors get sick, then our efforts suffer. The vaccination rollout slows down, the isolation facilities, the testing slows down when medtechs of Red Cross and swabbers of LGUs get sick. All of this slows down. So I think we need to find a way. One of the key strategic shifts, I think, will be to make the responsibilities more shared outside of the national government and the LGU. And one way of doing this in the vaccination program is to involve the private sector, especially our pharmacies. And there are thousands of pharmacies, of boticas nationwide. And if we are able to involve all of them, and if they can do 150, 100, 150, 200 a day, you can just imagine the access and the volume of jabs we can do on a daily basis. So we're very, very thankful to all the pharmacies and all the private sector groups that have joined in very quickly on this, and we hope to really roll this out nationwide soon. We're also looking at expanding vaccinations to workplaces, which PA Joey has already started through Go Negosyo and their partners, and also in other high traffic areas such as transportation hubs. The DOTR will be launching in PITX soon. We hope to launch also in other transportation hubs, ports, airports, bus stations, train stations, so that we can, in conjunction with the policies now to protect our unvaccinated by limiting their movements, especially in alert level 3 and up areas. We want to provide opportunities for them to have access to vaccines immediately. So we're going to be doing that and rolling that out also in the coming days through the efforts of the Department of Transportation, as well as their private sector partners such as Megawide in PITX. But more than that, I think we also need to have a dramatic change in mindset. I think we need to understand that the responsibility for dealing and living and protecting the community from the virus is much a individual responsibility and not just a government responsibility or a company, private sector responsibility. So we need to also empower people to and educate them how to deal with this virus, and how to deal with it in the foreseeable future. Interventions and policy shifts such as allowing home tests using antigen tests, similar to what they do in the US and in Europe, I think is very welcome. And we are anxiously awaiting for the FDA to approve I think more than 11 applications already for home antigen tests that can be bought and sold and bought by our people in drugstores throughout the country. Hopefully that will come very soon, but it has to also be guided by expert advice. We can't just have people testing themselves without guidance and interpreting those tests as they see fit. These have to be guided by our experts, and I'm very happy. I think some of our doctors are here to provide that guidance. But also to exercise responsibility on continuing the practice of the minimum health standards, especially the wearing of masks. We are a very strong advocate of continuous mandatory mask wearing, and our people have to follow that. Because as Secretary Duque has always said, the vaccines protect against severe and critical disease, but it is actually the mask that protects us against transmission. Ito po ang talagang protection natin para hindi tayo mahawa. Itong patuloy na pagsusuot ng mask. So kailangan po tuloy-tuloy po yun. Maintindihan ng ating mga kababayan na wearing of the mask is going to be with us for some time. And it is really our only way to live a close to normal life. It's inconvenient, it's difficult, I know, but it needs to be, I think, the message has to be strongly delivered that this is going to be a part of daily life for all of us in the foreseeable future. And also, I think we need to really inform our people that of the simple message that if we have symptoms, sipon, ubo, sore throat, then we need to stay home. We need to limit contact, and we need to exercise personal responsibility for that. Even without a test, if you have symptoms, you have flu-like symptoms, you have a cold, you have a sore throat, you have a cough, stay home and isolate yourself and protect the members of your family. These are all, I think, part of this shift in paradigm and strategic focus that we all must have, but it will require a lot of help from everyone, from the private sector and from individual Filipinos who need to exercise individual responsibility as we try to move forward and really try to live with this virus and open up the economy already, because we really cannot take any lockdowns anymore. So we really need to work together on that and shift the strategy, shift the responsibility, and really sharing the responsibility amongst all of us Filipinos. So finally, I just want to give up an updates on the vaccination program since Secretary Galvez is unable to join us today. He's actually in Makati now in QualiMed, and we want to thank the Ayala Group and QualiMed for also opening up their clinics to vaccinations. Right now, as of today, we are at 122 million jabs already. Another milestone, we hit 120 million 2 days ago. We have, out of the 222 million, 60 million Filipinos have received already at least one dose. 57 million are already fully vaccinated. and close to 6 million have already been boosted. So those are our numbers today. They're already very significant numbers. However, we still need to push this. We're roughly, because of the Omicron surge, our daily average has been going down. Jopin knows that very well. She's with us every day in our daily meetings. And this is more a factor due to personnel getting sick. And this is why we really pushed the activation of our pharmacies, because this is another set of personnel that we can utilize, and we want to further utilize them throughout the country. But we need to push this some more, especially we still have roughly about 16 million adults who have not received even just one jab. No, and we really need to push this. And again, we want to thank PA Joey, but we do want to ask our private sector partners and the companies to help us out in boosting our citizens, especially your employees. Now, if you can boost them already at the workplace using the vaccines that you have procured, that would be a huge help for the national government. So with that, po, again, thank you very much again, Joey, Jopin, and everyone. And let's all work together to really move from being afraid of COVID-19 to trying to live with it. With that, thank you very much, and God bless everyone. Thank you, po.
Thank you, Vince.
Yeah, we're really, really grateful that you found time. Singit po ito because we know that you're medyo lagari kayo. So, Joey, you wanted to ask a question, or can I ask something from the audience?
No,
Yeah.
go ahead.
Hey, Joey, sorry, we're gonna start here at TGP in Paranaque.
Oh, okay.
If that's okay po.
That's fine. Thank you.
I'll just have to join Mayor Olivares and Miss Robina Gokongwipe in this event. But again, thank you very much po for the efforts of everybody. God bless po.
Thank you, Sec Vince. We'll message you.
Thank
All
you,
right.
po.
So we're very grateful at least that Sec Vince was able to join us this morning. As you know, that he is basically the COO, or the operations person behind the implementation of the vaccine rollout, the testing rollout in the beginning, and then now in the vaccine rollout. So if there are any specific questions that you would like to ask of Secretary Vince and IATF, please feel free to message us or put it in the chat box, and we'll make sure that we address it to them and give you the answers after this meeting. Just to thank our media friends who are here today. We have GMA7, Saksi Ngayon, People's Journal, Philippine Star, ABS-CBN, PTV4 News, and TV5. So to everybody, again, please feel free to keep adding your questions. Our speakers and their team members are also here. They are reading your questions as you are typing them. So when their time comes, they will be addressing these questions. All right. So we heard from our keynote speakers, gave us some reminders, and we will be amplifying these messages to you as we go along within the next few days. We now go to the situationer of COVID, something that we really look forward to in partnership with Octa Research. Let's hear first from Dr. Guido David, who will share with us some numbers and updates. Dr. Guido, magandang umaga po.
Hi, good morning, Jopin. And thank you again for inviting me. PA Joey, of course, Sec Vince, all our media partners, the other speakers, and our guests, friends from the business sector. So I'd just like to share my screen. So I'd just like to give a brief situationer and some projections as well, what we can expect over the coming weeks based on the patterns that we're seeing. Okay, so, okay, and we go back to the situation of the South Africa, and this has been the model that we have been looking at even before the start of the Omicron wave in the country, in the NCR, because there's something uncharacteristic about this wave. It increased so rapidly, and then it suddenly decreased after about more or less about 2 weeks. We were hoping that this would be the pattern that we would see in the NCR. And in fact, it is close to what we're seeing. And this is a situation in the NCR. Of course, we see that the peak actually rose to about 18,000 cases and about 3 times the previous peak during the Delta surge. And this is also instructive because I'll be using this later on, that the estimated peak we're seeing is about 3 times compared to the previous peak during the Delta surge. Now, for the NCR, this is what we're seeing. We're still seeing a high reproduction number of 1.58, although this has already decreased. And I'll be talking about this a little bit more. The ADAR is still at critical level. And the positivity rate is still very high. The only the silver lining here is that the healthcare utilization is still less than 60%. So the overall risk level is still at critical. And this means that, we're not yet out of the woods as far as the wave is concerned. Now, I want to show the calculated reproduction number in the NCR, and then it increased to about 6, and then it started decreasing. And I wanted to show this because when I was plotting this, I was actually a bit surprised. Well, maybe I shouldn't have been surprised, but to note that the decrease in the reproduction number started on the 3rd of January. And why is that? Well, I checked, and I think that was when the alert level was moved to alert level 3. So it did, in fact, help to reduce the reproduction number. And we can see that it has decreased so far down to about less than 2, like I mentioned, 1.58, and it's still decreasing. As for the new cases in the NCR, we see that there's already a downward trajectory that we have observed. In fact, the weekly growth rate is now negative 20%. That means the number of cases this week is 20% fewer than the number of cases in the previous week. And these are the projections that we made. And we can see that based on our estimate, the situation would be highly improved. Even by the end of the month, we're projecting, maybe just a little over 2,000 cases per day in the NCR. I mean, it peaked at around 18,000. So it could be between 2,000 to 3,000. And then by Valentine's Day, it could be at less than 1,000 cases. And by the end of February, it could be at around less than 500 cases. Again, these are very rough projections. We hope it can be used to guide some of our friends in the business sectors and even in the government. So just to highlight some key points, the reproduction number started decreasing on January 3rd, as I mentioned. The decrease of new cases is nearly as rapid as the increase during the surge. So it's almost symmetric. And to sustain the rapid decrease, I would say that downgrading to alert level at this time might not be advisable until the NCR reaches moderate risk, just to sustain the rapid decrease that we're seeing so that we could see those good numbers later in the months of February. There will be a baseline level that the NCR could reach at some point. This is not yet clear. Last year, we almost reached a baseline of about, I think, less than 100 cases per day in the NCR. So again, this is not yet clear because a lot of factors will be involved here. And then, as we mentioned, the projection shows around 2,000 to 3,000 cases per day by the end of January. I mean, hopefully this will come true. And then before Valentine's Day, around 1,000 cases, and then less than 500 by the end of, this means by the end of February. Now, outside the NCR, we're seeing actually an increase in cases, and this should not be surprising because the wave has spread out into other parts of the country. So back in January 11, only about less than 4,000 cases were from outside NCR Region 4A and Region 3, but as of yesterday, almost 12,000 cases were from outside NCR plus. So we can see that although there's a noticeable downward trajectory in the NCR and possibly in Region 4A, in parts of Region 4A, there's now an upward trajectory in other parts of the country. And I just looked at the Cebu City model, not because of anything, but well, Cebu City is one of the major cities in the country. I actually have projections for most other areas. This can be requested, Guru, but I'm just going to show Cebu City. And right now they're definitely on an increasing trend. It's not yet peaking. But based on the projections, it will actually peak at around less than 1,000 cases sometime by the end of January, based on the projections. Again, this is, well, 1,000 cases represents about 3 times the previous peak during the Delta surge, which is not shown here. Cebu City had about 300 plus cases at its maximum during the Delta surge, but this will be a faster wave again compared to the Delta. So, you know, our friends from Cebu will just have to brace for this and then wait for the wave to pass by. So, and just some last notes or observations. Again, the reproduction number was about 3 times higher. So this indicates that the transmission was about 3 times faster compared to the Delta. And the peak was also about 3 times higher compared to the Delta. So I don't think these numbers are, I mean, this is coincidental. And again, reminder that the peak is not the end of the wave. So we determine the peak and the downward trend so that we can estimate the timeline of the wave and when cases will return to fairly normal levels. So that's it for me. So again, thank you so much for inviting me, and I'll be, yeah.
Dr. Guido, please stay for 1 or 2 questions.
Sure.
All right. Well, a clarification first. So are the numbers that we are looking at, or that you based your model on, are still based on the RT-PCR infection detection, right? Or
correct.
do we have other data from antigen and other home testing?
Well, unfortunately, we don't have data nationally for antigen testing. We do have, we can see some data from some local governments on antigen testing. But I know a lot of people are asking if this is conclusive, if we're basing the trends on RT-PCR testing. And I would say yes, because RT-PCR testing is something like of a census, basically. It's like a survey. It's not the complete picture, but it's part of the picture that is representative of the complete picture. And that's what census and surveys are like. We don't survey 50 million people to ask about presidential preferences. We survey a few thousand and then project that to the entire population. So when we get a census from RT-PCR testing and we see a trend, that trend is usually similar to the overall trend, even if we don't have visibility on antigen testing.
Great. That's a very important point, Dr. Guido. And then if I may echo a question that is in the chat box now, there is somebody here, Ramon's son is asking, they're noticing that once NCR decreases, then the provincial areas will show an increasing trend. What do you say about this?
Yeah, that's definitely a pattern. We have seen that in the past, and I'm sure Father Nick will echo these observations. It's like a wave. There's like an initial wave, and then there will be ripples all over the country as cases start migrating to other parts of the country. I mean, we know that NCR is the center of trade and of commerce in the country, so it generally starts in the NCR and then propagates outward to other provinces.
Yep. Well, we thank you for showing the numbers to expect in the nearby provinces, nearby regions 3, 4A. And then also, of course, another major hub of trade is Cebu. So we do have friends from those areas here, and I'm sure they will be watching out for the next updates from you and the group. Thank you, Dr. Guido.
Thank you.
All right, and for insights and other information that we can glean from Octo Research, we have Father Nick Austriaco to continue with the presentation. Father Nick, magandang
Good
umaga.
morning, Jopin, and thank you again for the invitation to present today. So what I would like to do today is actually continue the conversation that we had last time. So the title of my talk is What to Expect After Omicron. So because as Professor Guido pointed out, and this is a curve that I watch every single day, on the red, you see the Omicron surge in the NCR. This is as of last night. And on black, you see the Delta surge superimposed on each other. And you can see that the Omicron surge is not only much higher, it is also coming down a lot faster than the Delta surge. And so, it's good news for the capital. Of course, there is still weeks of challenge and week of struggle ahead for our kababayans elsewhere, because for the Omicron surge, it's like dropping a stone in a river, and then the wave will start moving out. And the NCR was the hot spot, the initial focus of that wave. But the question now is what happens after Omicron? And I would like to present the best science that we have today to help to anticipate what will happen after Omicron. So I'm going to base my short remarks today on this paper that was published in the world-renowned journal Nature, where several scientists got together to try to give an account of what will happen to COVID-19 after the pandemic. Now, I'd like to point out that this was written on July 8th. It was published on July 8th, 2021, which means that this happened before the appearance of Omicron. So what I would like to do is, after discussing their recommendations and their findings, I would like to add on how Omicron has altered our perception of the trajectories that they've given. So they talk about, there are 3 plausible scenarios that scientists talk about, and they rank them. There's most likely and less likely. So the most likely scenario that they present is that COVID-19 will become endemic like the flu, and I would like to discuss what this means. Less likely, COVID-19 will become endemic like the common cold. So there's 2 different scenarios for endemic, flu versus cold. And then again, this third scenario, which is often talked about today, it will remain a pandemic with severe disease and high levels of infections. So I would like to talk about each one. So the COVID-19 will become endemic like the flu. This is what we've been talking about. This is the pattern for the 1918 Spanish flu pandemic. And so what happens here is that the Spanish flu evolved into a milder variant with significant transmission. So the variant was able to spread throughout the world. It was able to infect millions, hundreds of millions of people around the world. And you have to think of it this way. It's like there's a forest fire, but the forest fire burned all the wood. So there's no more wood to burn. There were no more people to infect. And so the virus burned itself out. It is still with us. So H1N1 is still with us. And we still get it as the regular flu. Now, this scenario, if this happens, and we believe this is what will happen, COVID-19 will become mild for most people. And we have now seen this with Omicron, but it will still cause hospitalizations and death for vulnerable patients. And this is what we're seeing now with flu. So most of us will get flu in our lifetime, and several times in our lifetime. And when we get flu, we will become sick for a few days. But for most of us, we will recover. But unfortunately, for some of us, those who are vulnerable, those who are elderly, those who are comorbidities, it will be incredibly challenging, and the flu may even kill them. So in this scenario, what will happen is that future COVID-19 vaccinations will be only for vulnerable people. We are always in the thought of boosting and boosting and boosting and boosting. But in this scenario, what will happen is that future vaccinations for vulnerable people only and not for most citizens. So this is what we think is going to happen. And antiviral drugs and other therapies have to be developed to mitigate hospitalizations and death. So we're thinking here of Molnupiravir and Paxlovid because we know that these, given in the first 5 days of COVID-19, will help our kababayans to heal at home without moving them to the hospital. Now, I just wanted to point out pictures of the 1918 Spanish flu. There were no vaccines. And yet the 1918 Spanish flu ended in about 2 to 3 years. And the reason, again, because the H1N1 virus mutated until it was mild enough to become endemic. So here's the question. How does Omicron impact this future scenario? So I point out, Omicron, as we now see, confirmed even in the Philippines, is a milder variant than the Delta variant. It is relatively mild. Most of our kababayans, sipon lang. It's now the dominant variant only after 3 weeks and in this country, and it will eventually become the dominant variant globally. Now, it has also infected a significant number of people, both vaccinated and unvaccinated. And you know, the Department of Transportation random testing on the trains suggested that on January 12th, over 1 million people in the NCR were positive on that day. So you can imagine significant numbers of people. And we know so many people in our circles, in our families, who became sick with Omicron, even if they were vaccinated over this past couple of weeks. But what this means from a biological perspective is that the immunological memory of the entire population is more robust. It is stronger because of this situation. And so I think this is a consensus around the world now that the Omicron makes this flu endemic scenario more likely. So Omicron makes it more likely that this is how we're going to move, not only because of the biology, but just as importantly, it changes the mindset of our people. You know, so many people, because of their memory of Delta, associate COVID with death. And so even with Omicron, significant numbers of people, when they were sick, rushed to the hospitals. This is not surprising and this is not unexpected. But so many of my Dominican brothers and my family and friends are now telling me, wow, it was incredibly mild. Now, again, I will end this talk by and I will say it again. It is mild, but it can still kill if you are not vaccinated and if you are not boosted. So the second scenario they presented is that it'll become endemic like the common cold. This is the pattern for the 1889-1890 Russian flu, which is actually now, we believe, not a flu. It was not caused by the flu virus. It was caused by a coronavirus, OC43. And the reason we know this, we believe this, is because if you look at the clinical picture of the Russian flu, what you notice there is people lost their taste, they lost their smell. No flu has this, COVID does this. And today, the common coronavirus, OC43, we all have had it in our life. It causes the common cold. And so this is a second scenario that scientists are talking about. There is no sign that COVID-19 will become this much milder in the foreseeable future. It took 130 years for the other coronavirus to become cold mild. At this point, we believe it will stay flu rather than colds. Now, I would like to address this third scenario. So this is the third scenario. This is future variants of COVID will be more transmissible, more severe. So we will have a pandemic that will continue. There will be more severe surges for the foreseeable future. And we will remain in a state of emergency for many months, for many years to come. And in fact, when I talk to people, this is their big fear. Their big fear is that next week, there will be a scarier variant than Omicron. And so we need to address this issue. Now, I'm going to address this issue as a molecular biologist because that's what my training is. And it's important to see that the molecular biology will help us to understand the medicine. So many doctors I've talked to are very scared of a scarier variant, and it's molecular biology that can address this. And this is the reason why. Omicron has, and I'm going to use the technical terminology first. Omicron has significantly constrained the mutational landscape of future variants of concern. Now, what does this mean in ordinary language? Because of Omicron, it is more difficult to make a scarier variant of SARS-CoV-2. And this is something many doctors are not familiar with because this is a molecular biology research program. And so this is the question that molecular biologists want to ask. How easy will it be for SARS-CoV-2 to become a scarier variant after Omicron? So when you listen to the news, when you listen to medical doctors, they will say, could be easy next week, next month. What turns out, this is a paper published from the University of Michigan and MIT, my alma mater. It was updated on December 22nd on Omicron. So it's really important to understand this finding. And I'm going to, again, this is the findings of the paper. So I quoted the paper just so you understand what they found. So the first one, it says, the structural constraints of the receptor binding domain of Omicron hamper continued evolution toward more complete vaccine escape. I will translate this into easy, ordinary language in a minute. And the second conclusion, the modest ensemble of mutations in Omicron is likely to comprise the majority of all possible escape mutations for future variants. What does this mean in English? It means this: because of Omicron, it will be very difficult for a severe variant to evolve. Now, let me explain what this means. So let's talk about the variants. So different variants have different spike proteins. And the spike protein is the key that the virus uses to enter your cell. So on the left side, this is a picture I've shown. You have the key from Delta. And on the right, you have the key from Omicron. And the red tells you the changes, the mutations. And you can see that on the left, there's some red, but Omicron has very many red. And so you already have many keys. You have alpha, beta, gamma, Delta, and Omicron. There are 5 keys, 5 spike proteins. And the Omicron is very, very different from the first 4, which is why when it first appeared at the end of November, scientists were really scared. But you see, what will have to happen if there is a scarier variant? It has to find a key that is different from alpha, beta, gamma, delta, and Omicron. They have to be so different. And yet, the key must still work. The key must still open human cells. This is very difficult. Why? Because if you change the key too much, the key breaks. So the molecular biologists have looked at Omicron and they said, can you change the key easily without breaking it? And they say it's very, very difficult. To try to change the key further, to make it more severe than Omicron, it is more likely than not you will break the key, which is why they say that the chances of evolving a scarier variant, and for a scarier variant, it is a variant that can escape your immune system better than Omicron, is really, really difficult. And I think I want to put this into people's minds because there is this perspective that a scarier variant is easy to get and a scarier variant could come. Could it come? Of course it can come. But according to these molecular studies, it is incredibly difficult to evolve. It's very difficult to appear. So it's unlikely to appear, even though there are no guarantees, because evolution can find unique and unpredictable ways to create variants that we cannot imagine. But at this moment, all the best molecular studies show that because of Omicron, and it was only Omicron that allowed this to happen, Omicron makes it very difficult for a scarier variant to appear, which is why what I predict is we will have one more vaccination cycle. We will have a vaccine against Omicron and we will be vaccinated with those. It's not a booster. So the original Wuhan vaccination was boosted, and data from Israel is showing that you can keep boosting and boosting. It will never really fight against Omicron. So we have a Omicron-specific vaccine that will give us protection against all the keys. And then it becomes more difficult for future keys to appear that are scarier. So this is why I will reiterate it. I believe that the Omicron variant is the beginning of the end. Let me go through all the reasons why. One, it causes significantly milder disease that lowers rates of hospitalization and death. It infects significant numbers of the population, thus increasing immunological memory. And this is something that I think many medical doctors are not really, it doesn't really penetrate their mind. It makes it less likely for a more severe variant to appear that is capable of complete immune escape. And so this is why, again, I will say, despite the tragic suffering, and there is enormous suffering because of Omicron, not only in our beloved country, but around the world, it is still a blessing in disguise because, as scientists are pointing out, it will accelerate the endemic. The endemic will come faster because of it. So, but I would like to end again by, because of there was, possible misunderstanding, misquoting, it still kills. We must be vaccinated. We must be boosted. We must be masked. We must maintain public health standards, and we must continue to strengthen our health infrastructure, and we must continue to purchase antivirals and other therapies. However, we must also move from crisis mode to control mode, and we must move from fear to responsibility. This is the only way that we can move forward in light of the Omicron surge, in light of what has come and what we are hoping for the future. Thank you so much. God bless us all.
All right. Thank you, Father. I think this is the most complicated or technical presentation you've made so far. And it's very obvious because nobody is, it's very obvious that people are trying to absorb it because nobody's typing in the chat box. But
what I wanted to do, because there was some misunderstanding last time, 2 weeks ago. So I said, I will hit them with the science today, right?
Okay.
This is the science that undergirds the view that I would like to, that especially since for many people, especially medical professionals, there is a view that a scarier variant is easy to get. There is a view that we have to be constantly afraid because anytime now, a scarier variant will show up. And what I wanted to show is that the molecular biology is actually not in favor of that perspective. Because of Omicron, the perspective is that it is incredibly difficult for a scarier variant to appear. And that is really important because our people have to know, because, our people are, I know my friends are saying, well, I cannot relax. I cannot, because there could be a scarier variant tomorrow. Yes, they could, but we can never guarantee anything. But it is unlikely because of the Omicron mutational the constellations of mutations in Omicron already.
Right. Okay. Joey, you wanted to ask something, or should I ask something from the chat boxes?
Yeah, let me just give you a short remark now. Father Nick, thank you for that excellent news. I was expecting something close to that, and you did it very well. And I think allaying the fears of everyone, and you're right, people are, after watching all of these horror movies, they expect the worst to come. And I'm glad that we're looking more positive towards our future, and especially, my few hours in the States gives me a semblance that, it's time to really move on. And you've been saying that for quite some time. And hopefully, as we see positive numbers come in the next couple of weeks or month, then we really can move towards living with COVID and start living a normal life. No?
Okay. All right. So thanks for that, Joey. Father Nick, we won't take up too much of your time, but I'd like to bring up some questions from the chat box. Maybe they want emphasis on the information you said that there should be coming out an anti-Omicron vaccine, which is different from the Wuhan vaccine. Tama po ba?
Thank you for that question. Yes. So the original vaccines that we have been vaccinated with, hopefully, were developed against the Wuhan strain, and we have been boosted. So that for most of us, we've had a third shot, a booster shot. And people are asking me, will I keep getting boosted every 6 months? And the data from Israel is showing that a fourth booster, it does improve, but it doesn't seem to be improving that much more where the benefit outweighs anything else. So I think a lot of people are imagining that what we will have to do is we will have one more